Love and health form the foundation and pillars that support all that you do to create fulfillment and success in every aspect of your life. Love within us guides our paths while our health enables us to drive forward. The two are inseparable and vital for growth and reaching your fullest potential. Welcome to Love and Health in America with Dr. Dewey Lee and Jens Johnson. Dr. Lee is an international speaker, author, and inventor of the Diamond Matrix.
The way I see my role is that I'm a guide.
And Jens Johnson, the Mindset Master, is a best-selling author, speaker, mastermind facilitator, and executive director of Dallas eWomen Network. Please join them and explore all the facets of love and health so you can achieve and live your life more abundantly. Here are your hosts, Dr. Dewey Lee and Jens Johnson.
Hello, everybody, and welcome to our very first episode of Love and Health in America. We are so excited to be joining you, and I'm telling you, I cannot be more happy to be sitting next to this guy right here, Dr. Dewey Lee. So, Dr. Dewey Lee, I'm on a personal mission that I'm going to help promote him to become the next Dr. Oz, because I can say this and you can't, because I think he's better.
I'll never say
I think he's better. I know you can't say that, but I can. So we're really excited because, you know, you and I have known each other for a while, and with everything that's going on in the world right now, there's a narrative. There's a big narrative that's happening, and it's a negative narrative, and it's a narrative of doom and gloom, and that's just not what we're about.
No, not at all. I think that's one of the reasons we started this whole idea. And you know, the sort of dichotomy of love and health, which turned into intricately linked, just like we talked about in the intro, and the work that you do, and the health, and also a lot of the spiritual area, and of course, primarily in health, but to combine these two areas and turn everything we do into a positive, direction, looking at things positive, looking at, let's say, glass half full versus half empty. Everything we do, especially in this age, is so critical. And
Right.
I'm so glad we were able to get together and put this together.
It was one of the things that when we were talking about it, we said we want to have a conversation, not confrontations,
Right.
because there's people attacking one another. There's not enough love in this world right now. People they're divided like never before,
Right,
and
right.
so much of this division is over health. We're not even talking about love. We're not even addressing it. And one of the things that we're going to be doing on every episode is we're going to bring valuable content.
Yes.
We'll bring valuable content to you. We will be having conversations, and we're going to be spreading a message of hope, of love, and of good health. And not just physical health, but financial health, because that is one of the three pillars. And we're also going to be talking about spiritual health and mental health. Good gosh,
Exactly.
what's
So
going
many
on
things.
right now in the world with mental health. It's scary, the suicides, the abuse, and there's just not enough people talking about positivity and really sharing both narratives. So our episode today, our theme we're going to be talking about is COVID-19
Yep.
through the eyes of a physician, which we got Dr. Dewey Lee right here, and through the eyes of a wellness professional. So for those of you who don't know me, my undergraduate degree is in health and wellness, and one of the things that we've said so much is people are not talking about wellness and prevention and how to boost your immune system. So we're going to cover all of that today.
Right.
But my very first question for you, it's packed. It's
Yes,
packed.
I know.
It's loaded.
We have a lot to talk about. Yeah.
And that is, how has the COVID pandemic affected your practice?
Wow, well, it is a big question. I mean, it affected, in all ways. I mean, certainly in terms of patient throughput, number of people coming in, down like crazy. And I'm not alone. We know about this for the whole country. And there are hospitals that are closed. A lot of doctors and nurses laid off. It was a disaster in many aspects. In terms of that. But for me personally, my own practice has decreased by 90%, and slowly coming back. And I think people are getting off their fear a little bit. And there's been enough instructions about keeping yourself safe, et cetera. So people are coming out. And also I'm doing a lot of testing in my office. So that has allowed people to come in as well to at least get some, relief and calmness of the mind about what's going on.
So what I want to know is there's a lot of fear.
Yes.
There's a lot of fear. Now, I'm just not a fear-based person. I'm one of those, and I might be a little crazy, okay? I'm a quarter crazy minimum. But I'm not scared.
Yeah.
I'm not scared of the virus. Now, I'm respectful that other people are scared or may be scared, but I want to talk to you about, just even the situation with the mask.
Yeah.
There's such a huge debate, and I want to know your thoughts about the mask debate.
Yes.
But I also want to know, why is there a debate? Shouldn't the science be so clear that it's one way or the other?
Yeah, unfortunately, it's not that clear. And so let's kind of go back to the, a little bit of what, how you started this thing. So I just want to tell everybody, all the stuff I'm going to talk about today is my own personal opinion. It's not medical advice. So I just want to make that clear, because, as often when doctors talk, people think, oh, he's giving advice or whatever. So I just want to make that clear. Obviously, I see patients, and if you have further questions, I'd be more than happy to see you in the clinic, and that becomes a more medical advice type of thing. But for everything we're talking about, this really is my own personal opinions blended by my professional experience. So I just want to throw that out. Unfortunately, the reason we have so much difference in division, all the things you mentioned, is I think so much of this has become politicized. Mm-hmm. It really has gone way beyond the realm of science. And masks is no different, testing is no different, and all the treatment stuff that we're going to talk about later today, that is no different either. And that really is the problem, is that the science is a little bit more cut and dry, but of course there's plenty of controversy in science as well, believe me. Some people believe one result and they won't believe one, and some people believe some other results, and there's back and forth in discussion, but that's what makes science, progress. But unfortunately, the politics of our present time has, I think, invaded into this area, and that's why I think there's so much confusion and fear, and for me, in my personal opinion, unnecessary fear. Mm-hmm. Just like you, when this whole thing started, I thought, okay, there's something going on from almost like a war type of perspective, and I was never afraid of this, even though the idea of pandemic and all those kind of things, just like you, I thought, okay, this is going to be a virus, a pneumonia type of lung problem, but I really didn't get a sense of the direness and the doom and gloom that they were propagating for my personal reaction to this. So I was a little bit more maybe nonchalant about it, but I think with enough ideas of my own based on my research, that I really never saw the need to panic and hide under the table and thinking the world's going to end. So that's how I approached it. And so the different things coming down, including the masks and all those kind of things, I looked at that and said, okay, masks can help. And when do we actually wear the mask? I mean, I'm a surgeon, so when do I wear a mask? Well, I wear a mask when I'm in the OR operating, because I want to protect patients,
right.
The interaction and things like that, and keeping things clean. So there are different protocols in terms of when you wear a mask. And this is an example, of a surgical mask that many people wear outside. And this is very common. We wear it and then you throw it away. So this is something that needs to be worn once, thrown away. It's actually, some people I think even try to keep it clean and wash it or something, but you cannot do that.
Listen, I'm going to tell you.
This is not good.
I'm going to tell you right now, Dr. Lee, I have one like this, and I've worn it about 20 times.
Okay.
Minimum.
Okay, well, you're not alone. I do the same thing. So I think, unfortunately, this is kind of the natural evolution of this kind of problem, is that this has become a social lubricating instrument. It allows you into certain places,
right,
so that's what you wear.
But you know what is driving me just bonkers is it's the shame. It's the social shaming.
Right.
Number one, one of the things that I think in my head, and sometimes I say it, sometimes I do, is I'm not sick and I'm not scared.
Right.
So, but to think that where we are right now is you can't go into places unless you're wearing a mask.
Exactly.
Now, I just think that's wrong. It
is. And then, that has to do with your personal freedom and the different kind of things in terms of our Constitution and how we select different things for ourselves. I understand there's some support for masks, but, all the research I've read, I mean, there's really not a conclusive proof that masks help you.
Right.
There are studies that tell you that. There are plenty of studies on the other side that masks do nothing. So
right.
Which one do you choose? So people select a dogma. Well, my opinion is masks help, so I'm going to push the narrative and give you a mandate that masks help. At the same time, there'll be plenty of other tests on the other side that masks do nothing. in my own personal opinion, and based on my experience as well, yeah, there's certain masks that do different things at different times. The surgical mask should be worn in the OR, worn once, thrown away, and really it's not for general use. This type of mask, I think people see commonly, it's called the N95 mask, and this is actually a high-level filter mask. It has a certain functionality to it, but this again should be reserved for healthcare workers because they need this type of protection in an acute setting like the hospitals and ERs. And this is something that I think people see very commonly with a little filter on there. These are actually industrial masks that you wear when you demolish, buildings and you have dust and things like that. And you would have this mask to help you filter that out. It really is not for medical use. This one that looks nice and cool, and it's actually very expensive, is a cloth mask, has a filter on it as well. This is actually an N99 mask, has even higher filtration than this 95s, and this is actually too high, and the CDC actually hasn't recommended, you wearing something that high level of N99.
I want something that looks better, Dr.
Yeah, I know.
Lee.
Well, that's part from the fashion statements. So here's a fashion
If
statement.
I'm going to have to wear one.
So here's a fashion statement one. This is a cloth mask that a lot of people wear. You can literally take out a piece of your T-shirt and sew it up and put it on your ear, and that's a mask, right? Well, this is a little like trying to trap a mosquito through a chain-link fence. The holes in this mask are so big, it does really nothing to stop the viruses and even droplets. So there are a lot of different controversies and things like that in terms of what works. For me, for people who do have to wear a mask, and we all do at this time, I selected this. This is actually a copper mask. It's actually very, very thin, very pliable, has 2 layers, and has layers and layers of copper inside. And the copper has been known for hundreds of years to be bactericidal, and they've actually done tests on this to be antiviral as well. So the outer layer stops the droplets, and the viral particles that go through it get trapped by the copper and gets killed. So it kills bacteria and virus. So for me, just from my own personal side as well as professionally, this probably is the best option in terms of giving you the most comfort, efficacy, breathability, and literally actually having an effect against the virus and the bacteria. So this is what I would recommend.
So one of the things that I think it's really important for everyone is to make your own decision. Mm-hmm. You know your health. You know what you're experiencing. And if you have a pre-existing condition. And so I think it's important that people are educated on the mask so they can make their decision. Now, you talk about this, this copper mask over here. Mm-hmm. Where do you get that?
Well, a lot of different places sell them. Actually, I started offering it in my clinic as well. So there's a little bit of disclosure there. But the reason I'm doing that is because for me, I thought this was the best copper mask I found. I don't know if you can see it on camera, but the lines of copper, which is a copper oxide, is very, very dense. Mm-hmm. I've seen many that have a lot of spaces in between, so I didn't like that. But this one is very tight, compact, so it's a lot of copper protection. So this is the one that I've seen that actually has the best copper material, and this is a reusable, washable. You can wash it 30, 40 times and still just as good. So for me, I thought economically it's great. Functionally, it's great. Medically, it provides a lot of protection. So since we're stuck wearing masks, whether we believe it or not, I thought, why not, find the best one that you could find that makes sense for people.
Right. And everybody likes choices.
That's right. And they come in different colors.
Especially women, we like choices. So I love that you've covered the mask. Yeah. And when this first happened, I don't know if this happened to anybody out there. It happened to me. When the first shutdown happened and they said, it's going to be 2 weeks.
Yeah.
I don't know about y'all, but I thought I was
never believed it.
I just thought I was taking a 2-week vacation. Yeah. So I'm eating chocolate chip cookies every night. I've got family coming in. We're taking it easy. And then after the first 2 weeks, it was like, whoa, Scooby, this is going to be longer than 2 weeks. Yeah. And then people, there was just the unknown. And I think that's another thing that scares people is the unknown. Now, Of course, when you come from a place of faith, you come from a place of love, you don't have that fear. But with knowledge, there comes at least security.
Yeah.
And when all this craziness started, of course, the first place I'm going to go is to Dr. Lee. I'm going to go to my main man over here, which if you don't have a physician that you have a personal relationship with, I'm going to highly encourage you to develop one, whether it's with Dr. Dewey Lee here in the Dallas-Fort Worth area or wherever you're watching. We're living in a time right now where to what you said at the very beginning, Dr. Lee, is the government is, whether we like it or not, is politicizing health.
Yep.
And that is scary. It's a scary fact. And if you don't have a medical physician or people that you have a relationship with, you're really, it's scary.
Yeah.
I mean, it's scary. So now I wasn't scared. I've got a relationship with you.
Sure.
I reached out to you, and you were one of the very first physicians in the whole United States that got the antibody test.
Well, yeah. Well, I mean, I don't know about. Well, we started early, but I don't know if I was one of the early first ones.
I think you
know it's been
were.
early. Yeah,
I'm
certainly
stating
in the Dallas area.
I'm stating that.
Okay, well, thank you. So let me put this mess away, talk a little bit about testing, because that's kind of how it evolved. So testing came about because of all the things you just said in terms of, people's fear living. And, we're talking about love and health. So right now I'm talking about the health aspect, but, the other side that people were having trouble with is the love part. Why? Because of the forced isolation. If you remember back, it wasn't been that long ago that the lockdown for 2 weeks, et cetera, which I never believed it was going to be 2 weeks. I knew it was going to go for months. But anyway, so lockdown started. People started saying, okay, what are the two main ways to combat this? Masks and social distancing. So social distancing. Who are the vulnerable population? The elderly. So they were, we were kind of literally told, not necessarily mandated, but literally told to separate each other.
But is that even
family.
scientifically
No,
proven?
of course
What's
not.
the
It's
science
crazy,
behind social distancing?
Well, social distancing does make a difference in terms of, if somebody comes and sneezes, there's only so far that sneeze droplets will travel. And they kind of calculate it to be around 3 feet, 4 feet. So that's why 6 feet came about, because to minimize the effect of the droplets landing on you, heaven forbid, on your face and getting the virus that way. It does have an effect. Okay, and certainly in the flu seasons, regardless of coronavirus or not, avoiding direct contact does reduce your chance of getting an infection. So that does make sense. But unfortunately, I think the idea of separation went so far. People were literally living apart inside a single house. I mean, you told me your own personal story, and I certainly had plenty of patients coming in saying, I have my parents living with me, but I haven't literally talked to them. We talked to them, but I haven't literally touched them or hugged them. We don't eat together. So it's like, you're kidding. That's your family life. So that's really the main reason I actually started the antibody testing, to actually put some peace of mind for people, to really find out, okay, do you have the virus? Were you exposed? If so, do you have to have the long-term immunity, all the different scientific things that go with that? And so that's the reason I started the antibody testing. And, there's a controversy about this test, and I don't want to debate all the pros and cons, but based on my experience and my research, I decided this was probably the best effective tool, with all the caveats that I could offer for my patients. So that's what I did. So it's actually a very simple test. It takes 10 minutes because people didn't want to wait 5, 6, 7, 10 days for tests to come back. So literally in 10 minutes, you get a result after a tiny little blood, finger prick, that whether you have been exposed, whether you have an early antibody, or you have a mixture, or you have a late antibody. Okay, you get 4 different answers coming out of this. So if you have the late antibody, which is what everybody wants, okay, then chances of you getting reinfected is very, very low. If you have an early antibody, it probably means that you're probably getting through and getting off of the actual coronavirus. If you have nothing at all, then you've never been exposed, and you're just as if we've never been exposed to coronavirus or whatever. So at least having this information give people peace of mind. Okay, I'm not infectious. I have nothing. I can go and actually interact with people. Yeah, I know there'll be plenty of controversies of people watching this. I'm going to get emails about what I just said. But based on what we have at the time, and certainly the probability of catching the virus, just based on my mathematical analysis, I thought this is actually a very good option. Nothing's 100%, but this is an extremely good option for people to take, to at least have some information that, okay, I'm going to go infect somebody or not infect somebody. I can see my family, have dinner together, et cetera, et cetera. And that was the reason. So this really helped a lot of people gain some perspective of what they were. They were happy that, okay, I don't have anything. I can actually go home and have dinner with my family and be like a family. Okay, so that was the main reason for that. Is of course giving people the idea whether they've been infected or not. Then unfortunately this PCR, which is the nasal swab test, this is how everything got started. The actual, I don't know if you can see it, this is about 6 inches long. This goes inside your nose, way, way deep, and you squeeze it around. It's not fun. It's not fun.
Right now.
And then you have a little reagent, you put this in, and it goes through a lab. And before, it used to take 3, 4, 5, 7, even longer days. At the peak, it took 2 weeks because there's so many material coming in. Now they're down to about 24 hours at an emergency. Most of them can be done in 48 to 3 days. So if you're really in a hurry, you can get this within 24 hours. It's, of course, much more expensive. But people who are flying and they have certain restrictions need that 24-hour turnaround. So that's what I have this available for. So.
It's a question that I have is, what is the hysteria when the death rate is lower than the common flu?
I don't know.
So that just goes back to all of the politicizing of what we're going through right now.
Yeah, the actual, every day I get feeds, on the latest developments in the numbers, and the numbers getting lower and lower and lower and lower. The latest one I read, I think it was like yesterday, the actual, the disease death rate is about 0.3%. So, I'm sorry, 3.5%. But overall death rate is like 0.3, 0.4%, certainly less than that. So the overall, around the world, death rate goes from 0.5 to 1%. It's that low. Okay, it's extremely low.
And one of the things with me, with my undergraduate degree in wellness, is I don't hear people talking about prevention. I don't hear enough people talking in the media about what do you do to boost your immune system. So not even that you won't get COVID, but that you won't get the flu, that you won't get diabetes, that you won't be, that you won't be overweight. I mean, why are people not more concerned about helping people boost their immune system? One thing that blows my mind is a simple fact that if your vitamin D level is 60 or above, disease can't grow in the body. So why is it that it's recommended that you have a vitamin D level of 30? If
that goes back to the old RDA days.
So so to me, there's people are confused, and a confused mind does nothing, right? A confused mind gets scared.
Exactly.
So when we're talking about all of these, a mask is going to prevent a disease, why aren't we talking about go out and exercise, stop eating so much fat, stop eating all the sugar, get the inflammation out of your body? Why aren't we discussing that more?
Well, we will be. I think that's part of the aim of this, show we're putting together, is to talk about that, because that's such a huge topic. And, I think we talked about the diamond matrix that I developed, and that kind of covers that whole area of health maintenance and certainly a big part of prevention. And, hopefully people understand as we're going to be going forward and keep tuning in to watch us, because we're going to handle all that stuff.
Okay, so now, of course we can't talk about everything in this short period of time, but we're going to come back to you and talk more. But I want to know if you've treated patients with COVID, how you've treated them, and what has been your medical approach to that. Okay,
so of course that's again another controversy, and we're talking about hydroxychloroquine. This is really the, I think, most politicized drug and medication. It really is no longer a medication anymore. Now it's politics. And I never experienced this in my years of practicing, and I've been practicing for a while. So I think everybody knows hydroxychloroquine is an antimalarial drug. It's developed from that. It's been around for almost 70 years. Very, very safe. I mean, very inexpensive, very safe. And the research on this against antivirals that I've actually read, that goes back about 15, 20 years. There was one research paper that I tried to find, go back and find, and I couldn't find it, but I read that they tested 10 antiviral medications and hydroxychloroquine. And hydroxychloroquine actually did better than most of them in terms of killing the virus, in terms of the RNA virus, which is the class of, so we know it works, and it's been known to work. Unfortunately, in this day and age of this coronavirus we're dealing with, the prevailing thought is all of a sudden, well, it's not going to work for some reason. Nobody actually gave scientific proof. I know Dr. Fauci always talks about double-blinded study, which is just fine. We don't have time for that. But there's so much overwhelming experience around the world, not only from, I've treated a very small number of patients, about 24, 30 patients, but there's so many other doctors around Dallas area and certainly around the state and around the country that are much, much more experienced in this. And the protocol is very simple. I mean, you just take medications for about 7 days, 5 to 7 days, along with some antibiotics if needed, and with zinc and a couple of vitamins. It's very, very simple. And for those people who actually have cough, I add a little bit of an aerosol. I think there's a Dr. Bartlett in Western Texas who developed that. Fantastic technique, so I adopted that and included that as well. So the patients that I've treated, it's certainly not that many compared to others, but they have all done well, every single one of them. After about 2-3 days, fever goes away, they get better, cough goes away, and not a single one of them has had to go to the hospital. And this is really in line and reflective of the experiences that's been, given by so many other doctors. And I think we have a little short video clip of a doctor who did a little a video about 2 weeks ago. Let's see that.
The most important thing for the American people is that the restriction on hydroxychloroquine is due to overall censorship in our society. When doctors are being censored from what they can say, when there's a narrative of groupthink that we have to follow, everyone in America is going to be in jeopardy. So the biggest overall issue is the censorship and the disinformation campaign. We're seeing it now aggressively with hydroxychloroquine, because if you can get access to hydroxychloroquine, you can live or you cannot be sick. So that's critical. The governors are restricting our ability to do that because they're instituting rules that stop doctors from doing it and empower pharmacists from filling our prescriptions from doing that. So that's the concrete way we're experiencing the disinformation campaign is actually killing people. Harvey Risch, the famous Yale epidemiologist, has estimated that 100,000 Americans would be alive today, right, if we didn't have this massive disinformation campaign. The other really important thing specifically about the COVID-19 issue, if I could just say this, is that when people like Zuckerberg, which I just heard you say, said that what I was saying is potentially false information, I'd like to know where he went to medical school, all right? Because when you look at graphs all over the world, let's look at sub-Saharan Africa. Sub-Saharan Africa has the death rates, case fatality rates, like a fraction of what we have, a fraction, maybe like 1% of Western nations. This problem with COVID-19 deaths is predominantly Western European or American problem because we don't have access to chloroquine. You can get chloroquine in Latin America, you can get chloroquine in Africa, you can get chloroquine over the counter most of these places. You could get it over the counter in France and in Mexico before this whole thing started. So I'm saying, as a doctor, a person who's trying to heal patients, I would like to just give my patients hydroxychloroquine and zinc, which will save their lives, and also remove the spiderweb of fear that has overtaken Americans. We need to eliminate the spiderweb of fear. It's not the COVID-19 that's doing us in. It's a spiderweb of fear. Let's give Americans a way to say, you know what, I'm really afraid of this thing. So you know what, let me go to the pharmacy, let me just pick this up and grab it, put it in my pocket in case I need it. Other Americans who aren't as panicked over it can just go about their lives. Either way, both groups can go about their lives. I implore President Trump, it has gotten so bad, so dangerous. Please, let's make this.
See, to me, that makes sense, Dr. Lee.
Yeah, exactly.
What she is saying makes sense to me.
Yeah. Well, this goes into exactly what we're talking about, in terms of narrative of maintaining our own health. We are the guardians of our own health. Of course, if you're mothers, you take care of your whole family. You should not be a government or any elected official mandating how you take care of yourself and your family. And the thing with the hydroxychloroquine, exactly what Dr. Simone said, I mean, it's been around for decades. It's inexpensive. It's readily available. And why are we in the United States putting a huge block on this? Well, because of politics and the politics that we have. And as a physician, I went through the same frustrations that she's talking about, literally almost being criminalized for prescribing a medication that's been around, a safe drug. And tons of the media beating their drum about the complications with the heart and all those kind of things is totally bogus and certainly not within the realm of the stuff that we're using to treat coronavirus patients at all. So that's been the big tragedy, I think, in our country. I think that literally there's been a lot of people much more expert than I am who have come up and said over 100,000 people could have been saved had we used hydroxychloroquine early. And so that's the result of this divisive politics that we're living in. And hopefully this will stop soon. And I think there's a lot of grassroots movement to petition the FDA and state officials to loosen the access to hydroxychloroquine.
Yes, and and it really, it is the love that you and I have for our country.
Yeah.
It's the love that we have for the freedoms that we experience here in the United States of America. It's the love that we have for our families, for our community, and for freedom of choice and for liberty and the Constitution of the United States of America, that we said we can't not have a narrative of hope and of love and of peace and of inclusion, of uniting everyone. And, you know, we're definitely going to be talking a lot about health, and COVID is part of it. We're going to our next show in a couple weeks, we're going to be talking about the vaccines. And we'll dive deeper into that. But we also want to know what you want to hear. We know mental health is at a skyrocket pace, and we know there are people that are suffering, and we want to be an answer to those people that are suffering and that need hope. So please let us know, engage with us, share the show, and let us be a partner in your health and in your love. And we'll be talking about financial health as well and some other things like that.
That's
and
right.
I am going to say, if you would like to get an antibody test, or you would like to have a physician that is on your side and develop that relationship, there is no one better than Dr. Dewey Lee.
Thank you.
I just love you, Dewey Lee.
Thank you.
I'm serious.
Thank you so much. It's mutual. Thank you so much.
I love him, and we're just so grateful for your time. We can't wait. And so until next time, share your love.
And live healthy.